Good evening, Namaste, Nirmala. Hi, everyone. Good evening, Namaste, Nirmala. Hi, everyone. So let's begin with the pharmacology recall. Hi, Shabaz. So let's begin with the pharmacology recall questions which were asked in the FMG July 2023. Right? So, hi. So we are going to start in a while. So before that, few announcements are on the way. So there is an iconic subscription or this Unacademy Plus, and what you get is various concise syllabus which is covered through live batches, updated record, and you can have the chance to learn from the top educators in India. And we have a question bank with 75% case-based questions, access to PYQs, live tests, notes are there updated with already which are based on the recorded content, and the mentoring session. So you have the various prices which have been slashed down 5% for the duration, varying from 6 months to 36 months. So the second one is about the NEET-PG vitals, which are your recorded primary or a prime recorded content, and they are recorded for 800 plus hours, which covers all your 19 subjects, and they have all the clinical based questions, the PYQs, IBQs, so everything basically what you need. So please go on to the platform and subscribe to these recorded lessons. So let's get started with the questions. And yes, I would like you to answer it simultaneously. Even you might have heard it from others before, but still, let's have the response buzzing in the chat box and let's practice these questions. So the first question, which among the following is the antidote for benzodiazepine? This was the first question, one of the questions asked. The options given were flumazenil, flunitrazepam, barbiturates, and buspirone. So can you tell me the correct option? So I've been telling you constantly that antidotes are an integral part of the question paper. Time immemorial, one or two antidotes are always asked. And the same happened this time here. There were almost two antidotes which were asked. So very good, Nirmala. It is flumazenil. The correct answer is flumazenil, which is the competitive antagonist for the benzodiazepine receptor. So if you see the rest of the options, flunitrazepam is already a benzodiazepine. Barbiturates are not an antidote, nor they have an antidote in case there is an overdose with barbiturates. You will have to resort to hemodialysis if there is an overdose, or because they are acidic drugs, you need the alkaline diuresis. So the reason for barbiturates overdose that we don't prefer it as a sedative and hypnotic is one of these reasons. When if there is an overdose with barbiturates, you do not have any antidote to reverse the effects. Buspirone is an anti-anxiety drug. Right? It is an anti-anxiety drug. So the correct answer here is your flumazenil. Now the second question asked was, in the carcinoma cervix, which chemotherapeutic agent is used? Which chemotherapeutic agent is used, whether it is paclitaxel, cyclophosphamide, cisplatin, or topotecan? Yes, which chemotherapeutic agent is used? Which anti-cancer is used in CA cervix? Yes, please. Okay, Nirmala says B, cyclophosphamide. Okay. Any other? Any other guess? Alright. So here the correct answer actually is your cisplatin. Right? Cisplatin is the anti-cancer which basically are used for your urogenital cancers. Okay? So cisplatin is used for urogenital cancers like ovarian cancers, bladder cancers, cervical cancers, even for testicular cancer. So you use these drugs for all the solid tumors basically. So cisplatin is the correct answer for this particular question. Alright. So let's go on to the third question. In the third question, it was the 32-year-old male patient of thalassemia is experiencing symptoms of chronic iron overload due to multiple blood transfusions. What medication can treat his chronic iron overload symptoms? So basically, they're asking you the antidote for the chronic iron overload symptoms. Options, I guess, because if there is anybody who has appeared and they would think that there are other options, please feel free to let me know in case any change in the options was there or you want to correct it, because this is what I have got the feedback and these are the options which are provided. So any change, if you feel that there was a different option or the question was asked in a different way, please make sure that you tell me. Alright, Nirmala, you're absolutely, yes, accurate zone. It is deferriprone, right? So actually for iron overload poisoning, yes, it is D, deferriprone, and for this overload, patients can also be prescribed if it is, because it is not mentioned here, two options are not there, whether it can be this deferoxamine or deferriprone. This is an oral alternative and the other one we have the IV alternative. So if in case they mention specifically oral, then you write this. Otherwise, this is the only option out of the rest. Because EDTA is an antidote for what? EDTA is an antidote for lead poisoning. BAL would be for arsenic, right? Mercury, bismuth, gold, and these options. Penicillamine for copper. So the correct answer here is your deferriprone. Yes. Now this question is, I got it in a very simple manner, so I don't know whether whether it was a direct question or was there a clinical scenario given alongside. So that's how I could put it. What is a drug used for the treatment of pheochromocytoma? I only have one option in this. Anybody who knows that there were other options available, you can please let me know, or you can just write in the chat box later, because I only have one option with me because this is the correct option, so I could only put it. So phenoxybenzamine is used in pheochromocytoma. So we all know pheochromocytoma is a tumor of catecholamines, where there is excess of catecholamines in the body, and we use two drugs, which is alpha blockers and beta blockers, right? Yes. So alpha blocker, which should be used first? Whether you should use alpha blocker first or whether you should use a beta blocker first? What should be the sequence of the block? Yes, adrenal medulla, right? Catecholamine is an excess. So what should be the sequence of the drugs that you give? Whether you should give an alpha blocker first or whether you should give a beta blocker first? Very good. You should give an alpha blocker first, followed by the beta blocker. The reason being, if you give a beta blocker first, yes, if you give a beta blocker first, there will be all the catecholamines going to act on the alpha receptors, leading to dangerous hypertension, further going to increase the blood pressure. Very good. So, this was the fourth question. So, fairly easy question still now. Now, this one. Which of the following, yes, unopposed alpha action. Which of the following is a drug of choice for facial nerve palsy? Acyclovir, ceftriaxone, prednisolone, or naproxen? Which of following? Prednisolone. So the steroids, yes, steroids are actually the first line drugs for the facial nerve palsy because they are going to decrease the inflammation around this nerve. And then you can add on an antiviral. Very good, all of you. So it is the steroids is the first choice. And if required, you can add an antiviral later to support it in severe disease. But otherwise, you will always use prednisolone as the first choice or the steroids as the first choice. Okay. A woman presented with persistent sadness, loss of interest in the daily activities, decreased appetite and difficulty in sleeping. The diagnosis of depression was made, so most appropriate initial treatment will be fluoxetine, imipramine, bupropion or lithium. Fluoxetine, alright. So why do you say fluoxetine and not imipramine or the other options? So can you tell me why do you say it's fluoxetine and not imipramine? Okay, Nirmala says D, SSRIs. Yes, very good. So SSRIs are currently, no, TCA, which is TCA? TCA is the second one, yeah. Yes, because SSRIs are associated with less side effects. Tricyclic antidepressants are associated with a lot of side effects. So currently they are not the preferred initial treatment. So you always start a patient on an SSRI which have less amount of, which have less amount of side effects. So therefore we start with SSRIs. And what is bupropion? Again we discussed anti-anxiety, and lithium is a drug of choice for, it is used in mania and bipolar disorders. Right? Okay. So now another question. Yes, if see any SSRI you are given, you will choose an SSRI in any case. Okay? Yes, you can choose SSRI, but only thing is what they have differentiated here is they have given you a TCI, they were giving you an SSRI. So you have to select an SSRI here. That is the main thing. Alright, so again the second antidote, yes, so it is very simple that the patient has bought alcohol from the liquor shop, so presented with drowsiness, ataxia, blur vision. So blur vision, it is actually seen with methanol poisoning. Okay? Methanol poisoning, and it can lead to, patient can land into blindness also because of the excessive consumption of methanol. So methanol poisoning, the first, actually, if you ask me, the real antidote is fomepizole. But as this was not given in the options, the second best alternative is ethyl alcohol. In India, actually, fomepizole is not used much. They use ethyl alcohol, but otherwise, fomepizole is the first antidote. In case both are present in the options, then you must mark fomepizole, because ethanol is the second option. But here, because none of the others are used for ethyl alcohol management, so definitely the correct answer is ethyl alcohol. So the rest of the other options जो हैं morphine, diazepam, naltrexone, so none of them are used in the alcohol poisoning. So whether it is methanol poisoning or last time it was ethylene glycol poisoning they had given. So again usme the option was fomepizole, and here they have given a methanol poisoning with the option as ethyl alcohol, right? All right. So let's go on to the next one. An HIV positive woman who was not receiving any treatment, what happened? Gave birth to a boy. What was the newborn's initial course of treatment, or what should be rather the newborn's initial course of treatment? So nevirapine for 6 months, zidovudine for 6 weeks, nevirapine plus zidovudine for 6 weeks, and nevirapine for 6 weeks. Okay, B, A, all right. C, all right. C, okay. B, okay. Zidovudine for 6 weeks was initially used. Currently in the baby, we prefer to give nevirapine now for 6 weeks. Okay, so if because the lady is not receiving any treatment, so we give nevirapine for 6 weeks orally. As a syrup form it is available, so we give nevirapine for 6 weeks. Wasn't there? Okay. Nevirapine only. It wasn't there. Okay. Okay, if it is, because some said it was there, so I'm not sure. If it wasn't there, definitely then you can use the combination, but it doesn't make any sense because 6 months is definitely ruled out. This could be the answer because they say that if the patient is already, the female is already exposed to nevirapine, then you might give zeobrine in the baby. But because she's a treatment naive, she's not receiving any treatment, then the correct answer should be nevirapine. But yes, if 6 weeks, then definitely this one is also correct. It has to be 6 weeks, not 6 months. So if the second best option would be this, if it is not given alone. But if it is given alone, then this is the first choice. So Ravi, can you tell me what was the fourth option then? Was if nevirapine alone wasn't given, so can you help me with the fourth option? Was there a fourth option? Because I hope the rest are correct. The rest of the options were as it is. So just let me know later. You can just type in the the chat box later that if you remember what were the other options. Because then let's make the correct MCQ. Nevirapine wasn't there. Let's see what the other option was. Okay. Now, this was a group of friends planned a trip to Ladakh. One of them started having headache, nausea, dizziness, exhaustion symptoms while they were there. Which of the following is the best course of action for this patient? Sumatriptan, acetazolamide, scopolamine, promethazine. Yes, absolutely. All of you are correct. Whether it is for treatment or whether it is for prophylaxis, we use acetazolamide, which is there were options for 6 months both and 6 weeks. Then you select the 6 weeks wala option, right? 6 months is not correct. Then 6 weeks wala option you have to select. So drug of choice for mountain sickness. Right? So this is the drug of choice for mountain sickness. Now, had they given descent also as one of the options, that they should, or this one friend should come down, or he should descend down, then that would have been the first thing. So descent is the best thing to do when a patient is experiencing mountain sickness. They need to come down and then medication is given. Many of the people, they also start with the medication beforehand. They take acetazolamide beforehand, so that's like prophylactic treatment. Yes, before they ascend the high altitude. So this is Navira 6, Cedarvine 6. No, it can't be. I'm not sure. No, it should be both 6 weeks still makes sense, not 6 weeks. Cedar 6 months doesn't make sense. That cannot be the correct answer. Okay, so this is the drug of choice for mountain sickness. Sumatriptan is the drug of choice for, yes, sumatriptan is the drug of choice for, come on. It is the drug of choice for what? Sumatriptan. Very good. It is the drug of choice for, you don't write migraine, write acute attack of migraine. Okay, not for prophylaxis, only for, yes, acute attack of migraine. So, and the drug of choice for prophylaxis in migraine? Drug of choice for prophylaxis of migraine? Okay. All right, Ravi. Okay. Very good. Propranolol. The options were confusing. Okay, but for the rest, I find that they are very straightforward. I hope they are the correct answer options, because for the rest of the questions, I found them straightforward, except for one or two. Okay, Nirmala and Sahil, NSAIDs actually are the drug of choice for acute attack of rather mild migraine. But this acute attack of severe migraine ke liye, we use sumatriptan, or triptans basically they are used. Acute attack of mild migraines, NSAIDs are the best drugs, okay, for mild only. Prophylaxis ke liye, because prophylaxis is usually required in severe cases. Mild mein you don't require prophylactic treatment. Right, yeah, I found that they're very straightforward questions. and many of them have been the repetitions or are expected questions, right? So that's what I find. Except for one or two, I think, which are always the case. The rest were pretty straightforward, I found. So acute attack of severe migraine, okay? So we use sumatriptan, and for prophylaxis propranolol, and NSAIDs for acute attack of mild migraine. Alright, let's go on to this scopolamine. This is a drug of choice for? Scopolamine is a drug of choice for? Yes, very good. For the motion sickness. Excellent. Yes, motion sickness. Promethazine is also used in case of motion sickness. एक रह गया, ठीक है? So yes, motion sickness. And morning sickness के लिए doxylamine, right? Okay. Again, a very straightforward question here. Which of the following drugs undergoes Hoffman's degradation? Cis-atracurium, mevacurium, pancuronium, or vicuronium? Hoffman's degradation. This was not about nausea, vomiting. Which was not about nausea, vomiting? Future doctor. Which was not about nausea, vomiting? You mean this, the question, the Ladakh wala question was not about nausea, vomiting? Alright. So, yes, all of you are absolutely. It is cis-atracurium. That which of the following drug undergoes Hoffman's degradation, and this is your cis-atracurium. So what is Hoffman's degradation? Is the molecules in this structure, they get scopolamine. The scopolamine, we were just discussing the other options. So scopolamine is used in motion sickness. Yeah, I'm just asking you the other, like what, how will you, do you know the other options? Because what happens is when you're asked questions on a particular topic, you need to know not only that question, you need to know the other options, because there are chances that the other options might get asked later on. So it is not only about when MCQ जब आप कर रहे हो, the main aim is not only the MCQ itself, the correct option. The aim is also to understand the other options, because that is how you differentiate and that is how other questions are formed. So these are probable topics. So that's why I'm asking you about the other options. So Hoffman's degradation, and this is one of the drugs because it undergoes spontaneous molecular rearrangement and doesn't get eliminated or excreted by the kidneys, or it doesn't get metabolized by the liver. So it is very safe in cases of liver failure or renal failure. So that is another point about this drug, cis-atracurium, a very typical answer for this particular Hoffman's degradation. Alright, next. After undergoing lithium therapy for a year, all of the following adverse effects are visible except, or maybe it was that if patient has taken lithium for a long time, what adverse effects are not seen with lithium? So what is the correct answer here? Okay, A, hypothyroidism, D, tardive dyskinesia, D. Very good. Yes, it is tardive dyskinesia, which is not seen with lithium. Hypothyroidism is seen with lithium. It can cause both. Yes, very good. And tremors, fine tremors are the most common, earliest. Fine tremors are very common, seen with lithium. Diabetes insipidus, yes, very good. Diabetes insipidus is also seen with lithium, and treatment for lithium-induced diabetes insipidus. So it can become a question next year. So what is the treatment for lithium-induced diabetes insipidus? Can you tell me? Lithium-induced diabetes insipidus. Yes, Pritha, you're right. thiazides, not lithium induced. No, thiazides are used for nephrogenic. Yes, tremors, even fine tremors. Coarse tremors at a later stage, fine tremors is also seen. Coarse tremor. Thiazides are a drug of choice for nephrogenic diabetes insipidus. But for lithium-induced diabetes insipidus, yes, very good. It is amiloride. Amiloride. Okay? So remember, neurogenic diabetes insipidus, can you tell me what is the treatment? Neurogenic diabetes insipidus. Nephrogenic, very good, desmopressin. Nephrogenic diabetes insipidus, as all of you said right now, these are your thiazides. And for lithium induced diabetes insipidus, this is your amiloride. And yes, rightly said, this is tardive dyskinesia, which is seen with the, yes, typical antipsychotics. Typical antipsychotics. And this is the last EPS, or in the, the extrapyramidal syndrome, the last of the, it occurs at a very late stage, tardive dyskinesia. The earliest to occur, the earliest EPS, this haloperidol is a typical antipsychotic and it is the most potent, so all the more tendency to cause acute dystonia. Acute dystonia is the earliest. And the last is tardive dyskinesia. So we have acute dystonia, akathisia, Parkinsonism-like syndrome, tardive dyskinesia, and we have a neurolep malignant syndrome. This neurolep malignant syndrome is not related to the time period. It can occur any time in for any person. And important is, so when you have received a question on EPS, so you make it a point that you study everything about EPS, the management of all the symptoms of EPS, right? So iska kar lete hain. What is the management for treatment of tardive dyskinesia? If anybody can tell me, management of tardive dyskinesia. Or lithium is one topic, which ek lithium, digoxin, these are two topics which everybody should, you have to actually study, cannot leave this. Yes, valbenazine and deutetrabenazine. Okay, valbenazine and deutetrabenazine are used. Yes. So the names are important, not propranolol. Propranolol is used in akathisia. Akathisia mein propranolol is a drug of choice. But for tardive dyskinesia, we use deutetrabenazine. Okay, yeah. Right? So they are VMAT inhibitors or valbenazine. Alright. Next question. Which of the following drugs can cause thymine-less death of the cells? 6-mercaptopurine, 5-fluorouracil, methotrexate, azathioprine. Yes, right. 6-mercaptopurine, okay. A. I could find only these, and if, yeah, they were actually, I think we could find about 16, 17, normally 20, 25 are expected. So it's kind of either they have been overlapped with the medicine and the gynae, so that's why the overlapping is there, because that's what is expected, the clinical correlation, so they get overlapped with the other subjects. The direct pharma questions would be less now, and it will be more of the clinical based questions. So it can fall in the area of psychiatry or fall in the area of gynae, medicine, so that's why. Very good. It is 5-fluorouracil. Okay, 5-fluorouracil and not 6-mercaptopurine. Thymine, आप मुझे बताओ, is it a purine or a pyrimidine? Purine or a pyrimidine? चलो पहले हम ये कर लेते हैं, प्यूरिन है ना, pyrimidine है, so how can a purine be an answer to this? Simple, even if you don't know. Pyrimidine है, it's not a purine, ठीक है. So 6-mercaptopurine cannot be the answer to this question because ये कह रहा है कि the cells will have deficiency of thiamine and that's why the cell death is occurring. Thiamine-less, so they have said thiamine-less death of the cell. So deficiency है thiamine production में, ठीक है. So 5-fluorouracil क्या करता है? It inhibits the thymidylate synthesis. So it will cause the deficiency of thymine and therefore the cells will die. So you basically, again, mechanisms are important here. So जो anti-metabolites, if you study here, जो anti-metabolite drugs हैं, so either they are purine antagonists or they are pyrimidine antagonists or folate antagonists. ठीक है. So purine antagonist, yes. Purine antagonists कौन कौन से हैं? 6-mercaptopurine and we have azathioprine. Pyrimidine antagonists we have, important ones are the 5-fluorouracil and cytarabine. Folate antagonists we all know, it is your methotrexate and pemetrexate. So mechanisms equally important for drugs. So this tells you that you should know the mechanisms of the drugs. So यहाँ से you can make out the purine antagonists. So purine antagonist mercaptopurine, so azathioprine. So ये भी ruled out and this also ruled out. Methotrexate is a folate antagonist. The only left one is pyrimidine. So pyrimidine, thymine. So therefore this is the correct answer. Right? Okay. Let's go on to the next question. So which of the following is a drug of choice for CMV or cytomegalovirus retinitis? Cotrimoxazole, valacyclovir, tenofovir, ganciclovir. Very good. It is, this you have to know, okay? Time and again. So drug of choice for CMV retinitis is ganciclovir. There is no discussion, further discussion on this. So this is to know, yeah, must know. Now, a 55-year-old male complaints of urinary hesitancy, retention of urine, comes to the ER. On investigation, the ultrasound shows residual urine of 130 ml. Which of the following drug is used in the treatment for this patient? So patient has benign hypertrophy of prostate. So whether would you give calcium channel blocker, 5-alpha reductase inhibitor, ACE inhibitor, aldosterone antagonist? Very good all of you. So the correct answer is 5-alpha reductase inhibitors like finasteride. Finasteride. Now let's say a change in this pattern of question and they will ask you which of the drugs will cause immediate relief of symptoms. So let me not give you an option. So let me tell you, or you will tell me actually, the drug which causes immediate relief in the symptom of these patients. Which drug group causes, or which drug causes immediate relief? Isme 5-alpha reductase inhibitors, they will produce their effect over a period of 6 months. So Urimax is a trade name. Tell me the flavoxate. No. Flavoxate are used in overactive bladder. Prazosin, no. Sildenafil is a phosphodiesterase inhibitor. Very good, Manish. It is alpha blockers. Obi selective, yeah. Tamsulosin or silodosin. Okay? For immediate relief, you have to give alpha blockers. because they take care of the dynamic component. The signs and symptoms are taken care by this. But if you want to decrease the size of the prostate, then you go on with the 5-alpha reductase inhibitor like finasteride, dutasteride. So they are going to cause decrease in the size of the prostate, which is going to give relief to the patient. But this is a long-term effect. It will take about 6 months or so. Immediate नहीं होगा. So ये two important modalities हैं that you have to follow for patient of benign hypertrophy of prostate. So next one, a female delivered a male baby, and who delivered a male baby afterwards delivered PPH, and she was treated with ergometrin, but was not the doctors maybe were not able to stop the bleeding. Which of the following is the prostaglandin derivative which can be used for the treatment of this patient? Misoprostol. Okay. C. Carboprost. All right. C. Meso. A. Well, as per me, I think the correct option should be carboprost. Carboprost is used in the management of PPH. However, it is not the drug of choice for PPH. The drug of choice for PPH is your oxytocin. Okay? So, this is an alternative then to PPH. Misoprostol, you will see, or it will be more effective when you talk about medical termination of pregnancy. Okay? So, misoprostol along with mifepristone, it is used for medical termination of pregnancy. Carboprost, yes, oxytocin is the drug of choice, and carboprost can also be used. Okay? So, this was a question from the prostaglandins. Alright, so what is the mechanism of action of bedaquiline? All correct? Excellent. Very good, Ravi. Super proud. What is the mechanism of action of bedaquiline? ATP synthesis, some say B mycolic acid synthesis. Okay. Alright, so bedaquiline is a newer anti-tubercular drug, right? And it works, it's a static drug, and it works by the mechanism of inhibition of ATP. Okay? It works by the ATP synthesis inhibition, not mycolic acid synthesis inhibition. Mycolic acid inhibition, synthesis inhibition is seen by isoniazid. ठीक है, then the newer drugs में आता है, एक है dilamanid. That also inhibits the mycolic acid synthesis. But bedaquiline is acting by the mechanism of ATP synthesis inhibition. Okay? So this is the correct answer. So bedaquiline is an important question, has been asked before, and it is a potential question. So ATP synthesis, baki bhi you can remember, the delamanid or pretomanid, they inhibit the mycolic acid synthesis inhibition. Protein inhibition, the anti-TB drugs which do, they are the aminoglycosides. Aminoglycosides. And one of the main side effects which is seen with bedaquiline, it can cause QT prolongation. Right? Okay. So, in the previous exams, they had given the structure of the mycobacterial cell wall, and they had shown different sites, and you were asked to identify which of the drug acts on what particular site. So now they have taken a step further and they have gone to the newer drugs. So please remember. So anti-TB is another important topic. Yes, please. Yes, it is a patient on a psychiatric medication developed a hypertensive episode after consuming wine. What is the most probable cause? Very good. All of you are correct. This is the due to MAO inhibitor. So mostly it is your non-specific or non-selective MAO inhibitors. So what is happening in case of non-selective MAO inhibitors? So the patient who are on non-selective MAO inhibitors, they are instructed not to consume food which are rich in tyramine, tyramine rich diet. Or tyramine, yes. Yes, MAO inhibitors is the answer. So the tyramine rich foods is your wine, beer, pickled meat, yes, cheese reaction, cheese, okay, and wine, beer, pickle meats, cheese. I think these are the, yes, cheese reaction. So these are the major foods which contain high amount of tyramine. Now tyramine, what is the role of tyramine actually? It will go and act on the adrenergic nerve endings, and it will go and displace noradrenaline from the presynaptic nerve. And this noradrenaline is going to be released into the circulation. It will act on the alpha 1 receptors, and you know when non-adrenaline acts on the alpha 1 receptor, what it causes? Increase in the blood pressure, vasoconstriction, because and causes increase in the blood pressure. It has no effect on the beta receptors. So normally when tyramine is consumed in the gut, there are enzymes like which are MAO, monoamine oxidase, which will metabolize tyramine. But because the patient is on MAO inhibitor, tyramine is not going to get metabolized. It will escape this degradation, go and release a lot of noradrenaline, and that is going to act on the blood vessels, alpha 1 receptors, causing dangerous rise in the blood pressure, which is called as hypertensive episode. Now, another question which comes, what is the treatment of, very good, I was going to ask, treatment of cheese reaction is phentolamine. Excellent. Treatment of cheese reaction is phentolamine. It is B, that is MAO inhibitor. And I have said it's more it is more with non-selective MAO inhibitors. Okay? So that is important. If they ask you next time, it is more with, it is specially seen with non-selective. Yes, phentolamine is the drug of choice for cheese reactions. Right. Okay, I think I have these many questions. If you feel if anybody has access to any more questions, please do let me know. I could only get my hands on these very questions, and you can let me know here only. You can type in the message or message me on Insta, wherever. So if I can add more questions for you, then I'll be so happy, right? So I hope that all of all the students who had appeared, definitely they would get an insight. As Ravi said, he has got all the answers correct. Very good. And for the other students who are going to appear, so you get an insight of the questions. Very direct question. Most of the questions are very, very direct. All thanks. Oh, you got 12 to 13 out of this. Okay, very nice. Thank you. Very difficult to recall, I understand, but sometimes, yes, and many of times you don't want to recall also. But yes, if it's possible that you remember that a question reg, yeah, she did not cover this, so you can always let me know, because it actually helps the other students also. They would know the kind of pattern of questions that are asked. So many of them are so clinically oriented. So we all know that gradually the trend is towards clinically oriented questions. Ultimately, the answers don't change, but the way the questions are asked, they change. Okay, thank you everyone. Thank you so much, and hope that you could gauge an insight or get an insight into the questions. So study, keep on studying, and the more questions you solve, the better will be your recall, and better will be. All right. So thank you so much. Thank you so much. Darshan, thank you. All right. God bless everyone. Take care. Thank you so much, and see you in the next video. Good night, Pritha. Good night. Thank you, guys. Thank you. God bless. Take care.